Hi, thank you for attending today's presentation on leveraging your AEP through technology. My name is Tim Shook, Vice President of Cornerstone Senior Marketing. We are a national FMO based in Columbus, Ohio. I want to first of all start off and say thank you for being a NAHU member as well. It is greatly appreciated. I've been a member of NAHU for many years, and I'm also a current member of the NAHU FMO Advisory Council. To get started, we put out a simple disclaimer, and again, this presentation is meant for educational purposes as informational content. So if you have any questions, you can reach out to me. My contact information will be at the end of the presentation. Also, just some copyright information. If you would like a copy of this presentation, you can request that through the permissions coordinator at the National Association of Health Underwriters. The information is there. Today's presentation is going to be sponsored by TrustyCare. It's a technology platform. I'll show a quick video, quick commercial on what Trusty Pro is and what they do.
The administrative burden of selling Medicare is hurting you. In the spring of 2020, we heard this from far too many independent brokers and agencies. By the fall of 2020, TrustyCare had built a solution. Trusty Select Pro with Instant Plan and RX Review, the first Medicare agency management software to automate annual drug reviews, to give you your time back during AEP to sell more, and give clients the personalized attention they deserve. Trusty Select Pro was built with a network of independent brokers, agencies, and FMOs that contributed to every detail. We listen to you because we know helping you means a better experience for every older adult you work with. Our Instant Plan and RX Review automates the annual drug review process in 3 steps. To get started, use our secure integration with Medicare.gov's Blue Button 2.0 to retrieve clients' most recent drug, provider, and plan data in seconds. Once that data is saved, switch the platform to the Instant Plan and RX Review mode. Select up to 5,000 beneficiaries, and the software determines which beneficiaries should stay in their current plan or change their current plan. If no drug plan was saved, the software recommends the drug plan with the lowest out-of-pocket costs and compares it to the next lowest plan. Finally, you can select your entire client base and send out the drug review results at once. Trusty Select Pro has lots of other great features, including a robust administrative dashboard, lead management functions. You can add notes relating to the beneficiary and upload your own documents, such as an SOA. It provides one-click sync with Medicare.gov's Blue Button 2.0, saving pharmacies, doctors, drugs, and the beneficiary's current plan information in seconds. When it comes to direct digital enrollment, we are integrated with all major national carriers and a growing number of regional carriers. Every carrier that joins our platform makes it simpler for you to digitally submit clean applications. Our industry-leading customer support department helps you to learn the system and provides complete support. Our weekly one-on-one learning labs, training videos, and in-app navigation tools empower you to create efficient workflows. Together, we can reduce the administrative burden of your sales so you can focus on creating the best possible experience for your beneficiary. Come join us at TrustyCare to increase your sales.
Okay, thanks again for Trusty for being one of our sponsors for this presentation. The agenda I want to go through today, first of all, I want to go over some Medicare legislative updates, and this is some stuff that NAHU has been working on, and just kind of give you a quick update on that. And then also wanted to spotlight one of the benefits of being a NAHU member. And then we're going to look at the many ways of leveraging your AEP through technology, why to use, the benefits of it, functions, features, cross-selling, researching the plans, and then we're going to look at the technology platforms. So what I'd like to do first is give you a couple legislative updates, and this is what NAHU has been very adamant and working very hard to help with this. These are definitely gaps in where it does affect our current clients, and it's a loophole, and this is a way for them to close this and make this better for the consumer. But basically, the COBRA is credible coverage. The intersection between employer coverage and Medicare is fraught with landmines. People take COBRA for a variety of reasons, but pulling along a younger spouse is more common. So, people are working a lot longer than before, and many view COBRA as coverage, COBRA coverage as their group plan. So the problem is, what happens is when an individual is eligible for Medicare and they've worked past age 65 and they are now leaving their employer, they are eligible for coverage. If that individual, when that happens, when they're leaving their employer, that triggers their Part B open enrollment period. But a lot of individuals, if they're taking COBRA, not knowing any better than, just extending their group coverage. But if they fail to enroll in Part B in the timely basis, the individual will end up with a lifetime penalty for their Part D and as a late enrollee. So there is bipartisan legislation, which is H.R. 2564, which was introduced to treat COBRA as credible coverage for Medicare, the same way that similar employer-sponsored insurance is treated as credible. So NAHU has been working extremely hard with lead sponsors to evaluate the best way to achieve passage this year. The second legislative update is on observation status. There is bipartisan legislation, which is H.R. 3650, which would allow observation stays towards the 3-day mandatory inpatient stay for Medicare coverage of a skilled nursing facility. So if somebody is, if they break a leg, for example, and ends up in the hospital, they may only be put in observation care, even though they're staying overnight or for a few nights. But if they need to go into a skilled nursing facility, since they were not formally admitted into that hospital, it does not meet that 3-day requirement in order for them to get coverage for that skilled nursing care. So again, with this pandemic, the CMS has actually suspended this 3-day requirement, but NAHU is working extremely hard to make this change permanent. As being a NAHU member, there are a lot of benefits that you do receive, but one of the benefits I did want to spotlight during this presentation is the discount on E&O. They have a partnership with Mercer. You do get a 10% on your E&O. It is required for most carriers when you do contract, and then it just gives you another option to look at. They have been helping NAHU members understand their need for E&O coverage since 1999. So let's go ahead and get into the presentation. So we're going to be, again, talking about leveraging your AEP through technology. There's a lot of technology out there. I'm just going to show you an overview of a couple technology platforms. I would encourage you to go back to your FMO or to your upline to see what technology platforms that they do offer. A lot of them do very similar things. They may look a little bit different, but the end result would be the same. I always want to start off by a quote, and I really like this quote because individuals don't like to be sold to. They like to to be educated, and they want to as an agent, you want to be that trusted advisor. So sales is not about selling anymore, but about building trust and educating. And you'll see as we go through the different platforms that are available out here how you can do this through the technology. So let's look at why technology today is so popular. So first and foremost, it's a limited time frame. So during AEP, you have from October 15th through December 7th to do actual enrollments. And so it's about 59 days that you have to meet with your current clients and then try to write new clients as well. So you need something today that's going to be able to allow you to manage and take care of your existing clients, and then in a timely basis, and give them the necessary education that they need, and then also to be able to enroll some newer clients as well. Also, Medicare.gov changes. So back in 2019, Medicare.gov, CMS changed the the ability for agents to save prescriptions on Medicare.gov for their clients. And that created a big problem for a lot of agents. And so today's technology, it does give you the ability to save your current client's information in addition to the prescription drugs. So year over year, all you need to do is go into your client's profile. You can update, edit, delete, add additional prescriptions, and you're good to go. So you don't have to re-enter that every time. And then another popular reason why technology has been so prevalent here recently is the recent pandemic that we're currently going through with COVID-19. Last year, when everything shut down, this is when clients needed agents the most and be able to get the healthcare coverage that they need. And the nice thing with the technology, it allowed you to sell over the phone, do everything online, and be able to continue to provide that necessary coverage to your clients to get that coverage that they do need, especially during this pandemic. And then finally, consumer buying behaviors. I'm going to show the next few slides. It's going to be some slides on, it's from Deft Research, which is a national marketing organization that really talks about, explains the consumers' buying behaviors. And it's interesting to see, how individuals today want to be, how they want to purchase insurance and how they want to, be sold to and things like that. So we'll go through that here in the next few slides. So the first slide, the question was asked to the consumers, which of the following best describes how you would prefer to enroll in a Medicare plan when you're ready to go? And you can see more agents and individuals turning 65 would rather enroll themselves compared to the number of consumers who want to research on their own for Medicare plans. And you can see there's three different categories. One was commercial groups, so if they were on an employer-sponsored plan, or if they were on an individual plan, or if they were uninsured. And you can see, almost half the individuals would rather enroll themselves. Well, with today's technology platforms, consumers do have the ability to enroll themselves. You have the ability to put a link on a website where an individual can go to your website, click in, they can educate themselves, they can do their own shopping, and they can do direct enrollment through these technology platforms. Next slide, when they were asked, they were asked to choose all that apply. Over the past month, did you use any of the following websites to shop for or investigate Medicare health insurance? So when you look at it, almost half of the individuals went to Medicare.gov. Again, that's the government website. There's a lot of great information out there. But again, this goes back to individuals want to be educated. They want to understand what they're buying. Many times, this is the first time they've had to make their own decision on the health plan that they want to choose. If they were under a group plan before, the employer is dictating the plans that they can choose from. Now the individual has to make that important decision themselves by picking a plan that's going to best fit their needs. And that, again, that's why us as agents, that's why we play that important role. But you can just see as you go down some of the different websites that they look to. So, but again, it's a lot of they're out there to educate themselves. Another question, would you say that you've typically, or basically it says, choosing all that apply, have you used any of the following to shop online for Medicare health insurance? So when you can see that almost 60% of the individuals went out to do their own research and they wanted to learn. They wanted to understand a little bit more about Medicare, what they're in for, what it's going to cost them, how it works, and things like that. And then you can see on the other graph here on the side, it just shows you how what devices do they use to shop online for Medicare, with most of it majority being desktop computer or a laptop computer. You do see some using a smartphone or a tablet. Finally, which of the following best describes the method used to enroll in a Medicare plan? So you can see this has changed dramatically in the last 3 or 4 years, especially since COVID hit, but 62% of the individuals would rather do it online, to enroll online versus doing a paper application or any other method. So it's interesting to see, how much this shift has changed and how much there is a need for technology today. So let's look at what are the benefits of using technology. So first and foremost, a lot of the technology platforms today, it is a single platform. It is a one-stop shop where you can go out and you can store all your clients' information out there, and you'll have that at your fingertips. You'll be able to quote, compare plans, and you can do a direct enrollment straight from this platform. And it is extremely efficient. So instead of going to multiple websites or going to a specific website and then trying to do an enrollment, you have to go to a different carrier site to do that. This all can be done on a single platform. Also, the accuracy of it. So again, they're pulling information from the carrier sites. The nice thing about when you're doing an online application, that you have to complete everything on the application in order for it to be submitted. If you miss something, it's not going to allow you to go to the next page without fully completing that application. And with a lot of these technology platforms, it is embedded with your writing numbers. So as you're completing the online application, you will get linked to each of those enrollments to make sure you get that commission. And other technology out there, it does all this, and it also gives you the ability to manage your clients. So you can have all your clients within this technology platform. And more importantly, you can save all the prescription drugs, so you don't have to have, each client would not have to have their own individual username or password. You can access that information. When you're talking to the client, you can go in and you can just edit or delete or add additional prescriptions. And then also, as you're talking to a client, you can put notes in there. And if you need to follow up with the client, you can put in any reminders or any tasks. And when that is due for you to follow up, it will pop up for you to show what you need to do for that day. So again, some of the functions of technology, as we look through that DEFT research study, individuals are looking for education. They want to be able to educate themselves. Well, through these different forms of technology, it is an educational tool. They put a lot of information out there, whether you're researching plans or just information on Medicare in general. It does allow you to do a scope of appointment. As you know, it is required for every application that you complete a scope of appointment, and this again can be done online versus going, sending one in the mail, waiting for them to sign and send it back in the mail. It can all be done online quickly and done in the same day. It will also allow you to do provider searches. So if obviously when you're looking, more importantly, for a plan that requires a network, like a Medicare Advantage plan, HMO, or it's going to be extremely important for you to make sure doctors and hospitals are in the network. This type, the technology out there today gives you the ability to search the providers that are in the network versus going to each of the carriers' own websites. It also allows you to do a prescription drug search. You can put in prescriptions, and it will tell you if those prescriptions are covered and at what amount within each carrier's plan. There's also a plan finder, and it will show you all the carriers that are licensed within that state. Now, some platforms may only show you carriers that you're appointed with through that FMO offering the technology, but there are others out there that will show you all the plans that are available. And then within each plan that you can click into and show see the plan details. So what are the coverages for a specific plan? Again, I spoke about the online enrollment. It's a very important, very easy feature that if you're selling over the phone, if you're meeting with somebody or talking to somebody that does not want to meet face to face, you can do everything over the phone, do it compliantly, quickly, and efficiently. There's also cost estimators out there, so it'll show you, with the certain prescription drugs in particular, it shows you what the annual and monthly cost you're looking at based on the prescriptions and the plan that you've selected. There's also technology out there that gives you the ability to cross-sell. So if you're looking to not only write a Medicare plan, you can want to sell some other plans. There are the technology that will give you the ability to sell like a dental vision plan or a hospital indemnity plan, things like that. And then they also have tools out there that'll give you the ability to sell multi-product. You can put a bundled package together and enroll all in one for your client. And then lastly, the plan research. And again, as consumers want to be educated, you have everything at your fingertips to be able to do plan research, specifically information about carrier, how long they've been in business, just different things like that. So I want to start off, I want to show you some of the different platforms, what they look like. Again, please contact your upline or your FMO in particular to see what type of technology they offer. This is just some of this different stuff that we have used in the past. First, the Medicare.gov. Most of you are probably familiar with Medicare.gov, but it's an excellent resource to educate individuals to educate them on Medicare. Within Medicare.gov, you can see, they can shop for their own plans, but they can, there's additional resources out there as well where they can show you how, information on how to apply for Medicare, get Medicare costs, Medicare, if they're having card issues with their Medicare card, just different things like that. There's a lot of great information out there. And then also, you can see like under the basics tab here, how to get started with Medicare costs, what are your Medicare rights, identity theft and fraud protection. More importantly, there's a Medicare and You handbook. When individuals are eligible for Medicare, they will get their own copy of this, but they can go out and click into this, and it's a lot of great information on Medicare, the different parts and things like that. And then finally, you can also look at, here's some additional research that you can do, like how to get started with health and drug plans, what health plans cover, how plans work with other coverage, and also like Part D prescription drug coverage as well. So what I want to do is kind of go through some of the examples to show you how easy the technology is to navigate through. And mentioned about the scope of appointment, it is required for every appointment when you're selling a Medicare Advantage plan or a prescription drug plan. And it's as simple, the technology is as simple as you can either email, put in the client's email address and click email scope of appointment, or you can put in their cell number and you can text them a scope of appointment. Through technology, you also have the ability, you can print a consumer form. You can print the scope of appointment and you can actually send it over to them as well. If you have a scope of appointment that you did collect from that individual, it does give you the ability to upload it and put it in your system. As you know, you have to keep the scope of appointment on file for 10 years. This gives you the ability to save this information. You can see here like a scope for this example. A scope of appointment was completed on 9/1. This was done online, via text. Here's the confirmation number. Here are the products that the individual selected they would like to talk about. And you can always click view and you can view that scope of appointment. If you have your own CRM, you can click on view and you can print that and save it as a PDF and put it in your own CRM as well. I mentioned before with the technology, you can also search providers, and based on the information you put in the demographics of the profile of the individual, the zip code will populate here. You can change it if you wish, if they're going to a provider in a different zip code. And you can search by clicking doctors and other professionals or facilities or both. You can either type in the name or you can actually just scroll down and you can see on the map on the right-hand side the providers that are in the network. When you do see the provider that that individual is using, you can just click Add Provider, and we'll add that provider to that client's profile. And then you'll see here in just a few slides on how it does show you if that provider is in or out of the network with each of the carriers. The other important feature is the prescription drugs. As I mentioned, back in 2019, CMS no longer allowed agents to store their prescriptions out on Medicare.gov. The individual could only store it by selecting, creating their own profile, username and password, which the client would have to retain themselves. The agent was not able to retain that information. But through the technology, you're able to put in the prescriptions, and you're able to see this information and store this information within your own platform here. And it's as simple as where it's click search prescriptions, just click in there, start typing the prescription drug name. It will start populating the prescription drugs. Select the prescription drug that the individual is taking. Then you would select the milligrams, how many milligrams that they're taking, and then how many tablets they're taking on a monthly basis. And once it's stored in the system, it does allow you to go back. So if you go back and pull up the client, you can see you can go back and click on edit. You can go in and you can edit the prescription. If the following year, let's say their prescription is they're taking 20 milligrams of lisinopril versus 10 milligrams, they can go in, edit that, and change that to update it for the next AEP to make sure that they're in the right plan. You can also, if you need to delete, just click on the X. It'll delete the prescription out of there, and then you can also go back in and start adding additional prescriptions. If you have a client that has their own Medicare.gov account, this also has the blue button function where you can put in their email address, send them an email. They will give you permission to access that, and it would upload their prescription drugs into the technology platform. And then also, it's just as important as making sure you have the prescriptions in the system. It's also important to have the pharmacies as well. So you can, again, have the zip code where you reside. You can change it to wherever you may be going to get prescriptions. You can type in the pharmacy name. It will pop up automatically with pharmacies, and you can select with most platforms multiple pharmacies. And you just want to click Add Pharmacy, and then it'll show them as a pharmacy that you would go to. And then it goes on to the plan details. So based on the information that you've entered, it'll start showing you all the different plans that are available in your area. And for this example, you can see the plan here, and if you would continue to scroll down, you would see multiple plans. But it does show you, of the providers that I entered into the system, one of the two are in the network. So one of them is not, one of them is. You can click into it and you can see which one is, which one isn't. Of the prescriptions, it'll tell you how many prescriptions are covered. So in this example, both prescriptions entered are both covered. It does show the pharmacy that we selected, and then the estimated drug cost. And this was, when I entered this information in, this was for a 10/1 effective date. So this is showing the estimated drug cost from 10/1 through the end of the year. If I want to click on a different pharmacy, these are the pharmacies I had selected. I could click on CVS. These numbers would change or could change. This would show CVS. It would show me how many of the prescriptions are covered there, and then also the estimated drug cost. The other nice thing about this is when you see the plans, you can also go into the plan details of that specific Medicare Advantage plan. So you just click into plan details. Next screen is going to show you the coverages, how they cover specific specific services. It does show you the monthly premium, estimated drug cost, and then the total estimated cost. As you scroll down, you can continue to see what is their deductible, what is their maximum out of pocket. What does it cost for doctor office copay, for specialists? If I get hospitalized, how much is the inpatient hospital care copay? And as you scroll down, you can see all the different coverages. At the bottom, you can click in, you can see the summary of benefits, so you can see specifically how everything is covered. There is a comprehensive formulary list you can click into to see the formulary, to see specifically what tier levels prescriptions are going to be covered at. There is the option for the enrollment application for a paper application. You can also get it in a multi-language insert to put in as well. And then the star ratings, the overall star ratings of that plan. Within each carrier, it does give you the ability to go specifically to the carrier site to look up providers. You know, this is also a great way to verify, to make sure everything's correct in there. You can also see specifically how prescriptions are covered. So again, this was based on, over here on the right-hand side, Kroger was the preferred pharmacy that we selected first, but you can see I can check the CVS, and these numbers could change as well. Or if I want to go mail order, it will show you how much it's going to be covered copay-wise for the mail order. It does show you the retail cost of each drug, what the copay would be before the gap, when you hit the coverage gap, and then after the gap. It also gives you any restrictions. Does an individual need prior authorization for this drug? Do they have a quantity limit that you can get at one time? And does it require any step therapy as well? Again, when you click the other pharmacy that you selected, again, these numbers could change. You have the ability then, you can either send the quote to an individual, you can email it to them and they can view it and look at it themselves, or if they are happy with the plan, the information you've gone through, you can just click add to cart. When you click add to cart, it'll show you the plan that you have in your cart, the monthly premium for the plan, and then it's going to give you a couple different options. And this is how you want to do the enrollment. So you can either click on send a beneficiary to sign and submit. So basically you can collect the information, type in the information on the online application yourself. And then when it's time for the signature, you can, if you selected send a beneficiary to sign and submit, you can either text or you can email that application to that individual. They can review the application that was completed, and then all they would have to do is sign their name on that form, either via their finger or they can type it in. Or the other option is complete and submit form myself. And what that simply means is if you're meeting face-to-face with a client, you can have everything done right then and there, and then they can do the signature right there in front of you, and then you can it's submitted directly to the carrier. And again, I encourage you to talk to your upline, either your upline or your FMO, to see what types of technology plans that they offer, because there are many different types of technology plans out there. Another platform is the ability to help you cross-sell through using technology. And this example here is just how to help fill in the gaps. If you sold somebody, for this example, let's just say you sold them a Medicare Advantage plan. What you can do through this technology platform is you can put the Medicare Advantage plan that your client, that you sold them or they currently had in force, and then you simply go up and you click and fill in the gaps. When you click fill in the gaps, you can put you select a hospital indemnity carrier that you're contracted with, and then you can have the plans side by side. The nice thing about this is it shows you the base premium amount of $9.08 in this example, and this is going to give them some basic coverage for to cover some part of a small amount of their inpatient hospital copay. So, for example, if it's $350 a day, days 1 through 5, this may cover $150 of that. But as you scroll down through this, you can simply go coverage by coverage, and if that coverage is covered through the hospital indemnity, you can either eliminate or reduce the amount that copay is. So for example, for inpatient hospital copay, if an individual did not have the money or resources around, if they were hospitalized for 3 days and they had to pay $350 a day, if they wanted to eliminate that altogether, the agent can go in and put $350 of that benefit. Anytime you add a benefit, it's going to show you what the additional cost is. And typically for a hospital indemnity plan, for under $40, you can cover, eliminate, the hospital copays. But again, you can add other coverages as well. So if you're in skilled nursing, you can reduce or eliminate the copay there. You can reduce or eliminate ambulance copays, different things like that. So you can really customize a hospital indemnity plan around a Medicare Advantage plan that you have. And again, it's all done through technology. It's a great visual for a client to see, to really show how they can really cover themselves from any gaps that they may have. The other ability through cross-selling is you can create a bundled package. And for example, if you are quoting a Medicare supplement and you wanted to include a final expense and also a dental vision plan, you can put these all side by side and you can email that over to your client, or you can show them again what, if you're meeting face to face, what these bundled packages look like. Many of them are coming from group coverage and they're used to having a lot of these additional coverages. It's simply just asking them the questions and you're putting together a bundled package for that client. And again, you can either print it or you can and give it to the client, or you can put it in a PDF and email it over to that client as well. And the last piece I want to talk about is the research functionality. So this is what I really like about technology is you have a new carrier coming into town and you're just not sure, don't have much information about a new carrier coming into town, but you can actually do a lot of research through this specific technology platform. And you can see, overall, what is the carrier rate increase history. You want to make sure you're putting your clients with a stable company that's, not lowering the premiums just to buy business and then see significant increases year 2, 3, 4, 5, things like that. Also going to provide market data, and it's really, how many people, individuals does this company insure, both on a national basis and also on a individual state basis. And also for, do they give household discounts? So if you're looking at a Medicare supplement plan, if you have a husband and wife or 2 people in the same household, are you eligible for a discount? Can you save more money by with a specific carrier if they are offering a household discount? Also, does a carrier charge a policy fee? So if some carriers do charge an application fee or a policy fee. If they do, what is that? And then again, I mentioned how many years has the carrier been in the market. That's always important to see if it's a new carrier, if it's got some stability, it's been around for quite some time. And the other feature I really like with the technology platform is you can put in health conditions to see if a carrier will accept. So if you have somebody on a Medicare supplement plan and let's say, for example, their rates are getting pretty high, they want to see about maybe looking at a different plan. Well, if like some of the health conditions they have, you can put that into the technology platform and it will show you what carriers may accept that based on their underwriting guides. And I'll kind of show you some examples here. So first, just to research the plans, you can pull market analytics for each of the carriers. And again, for this example, you're going to see the monthly premium of the carrier's name, what is the household discount, if they have one at all. Do they charge a policy fee? This one charges $25. It does tell you how many years it's been in the marketplace. And again, this is not necessarily how many years the carrier's been in the marketplace, but how many years has this plan been in the marketplace. It does give you the AM Best rating, how they rate. This is rated based on attained age. AM Best rating, and then it gives you the effective date as well. What I like about this though is when if an individual's if you're looking at a specific plan, this is at age 65. It does tell you if the carrier did not take any rate increases at all, at each age, what is that premium going to change to? So basically from age 65 through age 68, the rate's going to stay the same. At age 69, they're going to see a 2.9% increase in their monthly premium. Now, again, if a carrier does take an increase, then these numbers will change by that carrier's annual rate increase. It also does show you the increase history. It shows you the date they took it, and then the percentage amount of that increase. And then I mentioned about the market data. It does show you how many lives on a national basis the carrier insures, and then in that specific state that you're quoting. It shows you how many premium dollars, both national and a state, that they collect, what's their overall loss ratio, and what is their overall market percentage, market share they have. I also mentioned about if you had health condition you wanted to put in the platform, you can also put that in there as well. For this example, I selected heart or valve surgery, including bypass and stents. So for this carrier, it's showing that if somebody had a stent put in, for example, or had a valve surgery, the look back period is 2 years. So if they had it over 2 years ago, there's a pretty good chance that the carrier would accept this client. Again, there's a lot of information that you can attain through the technology. It is going to make your life so much easier by utilizing the technology as well. The last screen I want to show you is just some of the larger names that you have in the technology platforms out there. Again, I'll say one more time to encourage you to talk to your upline, talk to your FMO about what platform they're using and what they can offer you as well. I do want to thank you for your time, and again also for your membership with the National Association of Health Underwriters. My contact information is below here. My phone number is 614-763-2259, or my email address. Feel free to reach out to me if you have any questions at all. But thank you.